Hello friends, today we will see how to identify rhythms. So after identifying the rhythm only, we can accordingly plan the treatment line for the patient. So first we will see the basic of finding rhythm. So here we can see there is a heart. This is SA node and this is AV node. And this is bundle of His and Purkinje fibers. Always the electricity or the conduction is initiated from SA node, which is called sinoatrial node. So from the sinoatrial node, the rhythm is generated so that the atrium is contracted first. While the atrium is getting contracted, there is a generation of P wave. And then once the rhythm is generated from SA node to AV node, which is atrioventricular node, from here the electricity is passed through the bundle of His and then to the Purkinje fibers. Then the ventricle is getting contracted. That time there is a formation of QRS wave. And this T wave is generated while the relaxation of QRS. I mean the ventricle. When the ventricle is getting relaxed, the T wave is formed. So this is the basic of conductive system. So based on this, if you are going to read any ECG, you have to keep mind all these 5 criteria. First one is P wave. If any rhythm which has P wave, it means it is sinus rhythm. Like we may have P wave in sinus brady, sinus tachy and normal sinus rhythm. These 3 rhythm we have P wave. If any rhythm which has P wave, it means it is generated from SA node. It means the atrium is contracting. So when the atrium is contracting, there is going to be a P wave and that is absolutely sinus rhythm. So only in the sinus rhythm you can see P wave. Like SVT and ventricular tachycardia, all those things you may not see P wave. Understood? So next one is rate. How are you going to count the number of beats? Like you in the ECG you could have seen this big box. There will be again a smaller box. Each smaller box is 0.02 second and each box 0.4 second and each big box is 0.2 second. 0.0 and 0.2. Each big box is 0.2. Like if you are having 30 boxes, then these 30 boxes just count how many beats are there. For example, in 30 box you are seeing 7 ECG means 7 multiplied by 10. So 70 beats per minute. This is how you will count the rate. In continuous 30 box, if you can see only 5, then it means 50, that is bradycardia. And if you are seeing like 9 beats means 9 into 10, 90, which is tachycardia. Sorry, this is also a normal. Like 11 beats means 11 into 10, 110, which is tachycardia. Always 60 to 100 is normal. Less than 60 is brady and more than 100 is tachy. And here PR interval. PR interval is from the initiation of P wave until the initiation of Q. So this is called PR interval. Any block rhythm if you see, like first degree block, second degree block, second degree type 1, type 3 and third degree block. 3 blocks are there, which I will be dealing in next video. So the conduction should start from sinoatrial and it should reach AV node, right? So when the rhythm is transferred from SA to AV node, if there is a block, this time is going to get prolonged. So when the rhythm is getting transferred from SA to AV node, if there is any block, this PR interval will be prolonged. So if you find any prolonged PR interval, it means there is a hot block. So there is also a criteria. Then QRS, whether it is narrow or wide. So if the QRS is too much narrow, it will be SVT. If it is broad, like ventricular tachycardia, will always have a broad QRS. So based on QRS complex, whether it is narrow and wide, also we can predict ECG. And there is one more, which is regularity, whether it is monomorphic or polymorphic, and the shape of the rhythm will give you some more clue. So based on these 5 criteria, we can identify what kind of rhythm it is. So next video I am planning to post videos regarding all Brady abnormal rhythms. We'll see in the next video. Bye.